They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we've got a new guest to the show. We have Dr. Jeff Jenson. Welcome.
Thank you. Nice to be here.
Where are you currently serving?
I'm at Springfield Clinic in Effingham.
Perfect. And how did you get into the field that you're in?
I had an interest in medicine from when I was young, and I explored that and kind of went straight through into family medicine and moved back here to Effingham because we have family in the area.
I was going to ask, so are you originally from here, or where are you from?
I grew up in several places around the Midwest and then met a girl in Effingham, and we got married and moved back here after I was done with my training.
You put down some roots. Perfect. So today we are talking about asthma. A little bit of background just for folks. I mean, we often hear it, but what is it?
Asthma is a hyper-responsiveness of the lungs, either a sickness or any kind of irritation or something. You breathe in, your airways actually go into spasm, constrict, and makes it hard to breathe. And so that's what you call an asthma attack. And it's more prevalent than most people realize. I think I looked up to prepare for this interview. Our current prevalence in the United States is 8 to 10% of the population.
So what is your background? What made you want to kind of talk about this today?
Well, I've always had an interest in asthma, even before I went to medical school, because my wife has asthma, and I saw her go through attacks and illnesses and saw the way it used to be treated before we have the medicines we have now, and what a big difference it made for her once we got her on the modern inhalers that we still use today, and how much that improves their quality of life and keeps them out of the hospital. And we also have a son who has asthma, so that's something that we deal with on a daily basis at our house.
So it looks like asthma is something that you treat for any age or at any age?
Yes. I am a family doctor. I treat all ages anyway. I treat any kind of breathing problem all the way from a newborn to elderly. And a lot of my asthma patients are younger, but I treat all ages.
Who do you, like what age group do you typically see it or diagnose it in more? Is there a group?
I mean, most of the time the initial diagnosis is in childhood. We have some people get the problems with it later in life, in the teenage years or in their 20s, but usually by the time people are fully grown, if it's going to present, it's already happened. So a lot of my new asthmatics are kids.
Gotcha. So what does this mean for a patient once they're diagnosed with it? Does it really impact their day-to-day, or is it just when there's an attack? How does that kind of play out?
Well, asthma is variable. Some patients only have trouble with it when they get a respiratory illness. Others have symptoms a few times a week, a few times a month, and the most severe cases can have symptoms all day, every day. So part of coming to your doctor is figuring out where you fall in which category, and then the treatments differ based on what we find.
If you don't mind me asking, what does it look like in your household since you've got 2 members who live with it?
So both of my wife and my son have what we call mild persistent asthma, so they have to take an inhaler every morning and every night that prevents them from wheezing and having exacerbations. And as long as they take their medicine, they really don't have any alteration of their lifestyle. But if they stop taking the medicine, the asthma symptoms worsen and return, and it starts to restrict what they can do and interfere with their sleep. And we've learned that they can't go without their medicine, but when they're taking it, it works very well.
And so for folks who maybe haven't diagnosed it, or got it diagnosed rather, what happens if it's poorly controlled? What if they're not treating it properly?
So something I've seen through my career as a doctor is that a lot of people who have asthma are not very aware of it. The symptoms come on gradually, and they just kind of tend to suffer through and go on. Some of them have never really been to a healthcare provider who has any interest in the area, and I've seen a lot of asthmatics come to me not being adequately treated, and I get them on the right kind of medicine, get their symptoms improved, and they tell me later that they didn't realize how much it was affecting their life, how much it was limiting their activities every day, and they didn't realize how easy it was to actually be on a good treatment and have such improvement in their day-to-day lives. So it's something I take great pleasure in treating because I've had a lot of success, and because the treatments are so good now.
Kind of the pun is a breath of fresh air. They can actually breathe correctly for the first time, some of them.
Yeah, they don't realize how bad it is until we get them under good control. And once they learn that, they don't go back. But I have a lot of untreated asthmatics who it just kind of creeps up on them and gets worse over time, and they don't realize how bad it was until we make it better.
So what does it feel like? Is it just a tightness in the chest, a weight on the chest? I know you said that there's a lot of variables for people.
So it's a difficult feeling to describe, I think, but when people can't adequately catch their breath, they feel like they're suffocating. They tend to get panicked, and anxiety makes the asthma attack worse. And once they get a severe attack, then they usually do come see the doctor because they don't want to feel that way again. But other people who have milder asthma just simply can't do physical exercise or hard physical work, and they think they're just out of shape or overweight, and they don't realize it's actually that airway restriction from the asthma.
I feel like one of the themes I'm already seeing in this season is if you think something might be wrong, go see your doctor, because you're the expert to help them sort these things out that could seemingly be pretty much anything if you're thinking you're out of shape, but it could be asthma.
Yes.
So as you're talking about the treatment getting better, start off, what did the treatment used to look like that wasn't quite as efficient to what does it look like today?
So years ago when I first met my wife, she would just take what we call nebulizer treatments. Anyone who's had a severe respiratory illness and been in the hospital probably has had these little cups that shoot out this cool mist, and you just hold it in your mouth and breathe that in. And that medicine works, but it wears off in a few hours. And so asthmatics would just simply take breathing treatments when they were feeling short of breath. It would make them feel better for a few hours, and then it could happen again the next day. The difference now is the treatments we give are what we call controller medications, and they actually reduce the inflammation in the lungs, reduce that extra over-responsiveness of the airways, and stop them from going into spasm so much, and actually keeps people from losing lung function over time. If you have very poorly controlled asthma, your overall lung capacity can be permanently damaged and lost. And so, it's almost like having COPD or emphysema in the most severe cases. But with the new medicines, we seem to have stopped that. So they have more or less steady lung function, other than just what we see with age. As people get very elderly, then everyone loses lung capacity. But the new medicines have made asthmatics live pretty much a normal lifespan.
And you're talking about it impacting people maybe just on a regular basis. They might notice it if they're just getting up, going up the stairs, things like that. What does it look like for athletes who have asthma?
Well, there is exercise-induced asthma. And the famous example, I don't remember the name of the athlete, but there was an Olympic sprinter who had exercise-induced asthma. And what we found is that we can give you an albuterol inhaler, and the athlete can take 2 puffs on their inhaler before practice, before a game, before a competition, and that alleviates their asthma symptoms and actually prevents the wheezing before it starts. And so based on, I mean, as you can see from that Olympic athlete's example, then it takes away that limitation. Without that, it would depend on the day. Some days they'll wheeze and have a lot of trouble and be hardly able to compete. Other days they'll have very few symptoms, and we know it's environmental, but we don't fully understand that. But if they see their doctor, get an inhaler, they can compete just like an athlete without asthma.
Are there, I guess living here in the Midwest, we get really bad spring, really bad pollen, things like that. Does that irritate folks with asthma more than the average person?
So asthma is very commonly coexisting with allergy problems, and your doctor will help you figure out if any of the allergies are triggering some of the bronchospasm and the wheezing that we see in our asthmatics. And there are medicines specifically for allergic asthmatics that kind of do double duty. They help control your allergies as well as reduce your severity of your asthma symptoms. That's not true for all asthmatics, but it's a very common coexisting condition, so it's something I always look for. If I have a new asthmatic patient, I always try to talk to them and see if they have a seasonal pattern. Spring and fall are the worst times in these parts.
Are there other coexisting conditions that normally come along with asthma?
The other thing that we commonly see, and there's actually studies in kids about this, is eczema or skin conditions. So kids that have these dry, red, scaly rashes and maybe have some respiratory distress, sometimes that there's some common causes there. It can be related to the skin rashes, it can be related to asthma. There's some overlap with food allergy, and there's a lot of developments in that field right now. There's research ongoing and studies. So we try to watch for rashes along with their wheezing, especially in kids, and just the seasonal allergies that everyone's kind of aware of. But we're making new connections between those conditions and finding new treatments now.
And so I know there are 2 asthmatics in your household. Is that by chance, or is it a little bit genetic?
Definitely there's a genetic component.
Okay.
For asthma, we feel that there has to be an environmental trigger that sets that off. So I have 4 children and I only have 1 asthmatic, so it doesn't happen all the time. We're still figuring that out. Genetic research is exploding and booming as we speak, so I think we'll have a better understanding of that in the future. But yeah, if you have a close relative with asthma, it definitely increases your risk. And again, I think we'll know more details and be able to give people more specifics on that in the future, but right now it's just kind of a historical thing we talk to with our patients who we suspect might have asthma, and if they say their sibling or their parent has asthma, we're much more suspicious and look even harder.
So we're taping this in May of 2021. The last year, and even still kind of now, COVID-19 has been rampant. The talk of the town, the talk of the world. What has this looked like in your household, having 2 folks who at any given time, if they didn't take their medicine, asthma could grip them.
Mm-hmm. Yeah, there's been even more fear of COVID-19 in our in anyone with any kind of a respiratory problem, and asthma was listed as one of the risk factors for COVID-19 early in the pandemic. I was taking lots of precautions when I came home from work, and my wife also was scared, not only for herself but for our son.
Right.
But thankfully, now that we've had some experience, there's been no obvious trend toward increased hospitalizations or death in asthma patients if their asthma is well controlled. So if you're seeing your doctor, you're taking your inhalers, and your asthma is under good control, you shouldn't have any higher risk of complications from COVID-19. Thankfully, in our household, we haven't had to fight the virus itself. We've been able to get the vaccine. But I've had several patients who I feel like I've had under good control, and they had COVID-19, and they did fine with it. They were sick at home for a week, and it didn't really cause them any additional problems than I saw in my non-asthmatics. So everything is preliminary with COVID, of course. We're not sure, but right now the outlook is pretty good for asthma if you have it well controlled. But that would be another reason to make sure your asthma is under good control, because if it's not well controlled, any respiratory infection could be trouble.
So if you're collaborating with your doctor and trying to figure out what your treatment should be, can your dosage of your asthma medicine, does that change all the time, or is that something that's pretty consistent?
Well, there are concerns with the mainstay of treatment in our asthmatics are steroids.
Okay.
We've known for years that steroids that you swallow in pill form have side effects with long-term use. But when they take the steroids in an inhaler, they don't seem to have the same problems. But your doctor will first try to get your symptoms under control, and then once you've been stable for typically, I'll wait about 6 months, then if things are going really well, we may try to slowly back things down and find out what the lowest dosage of what we call controller medications that still work to control your asthma. So yeah, there are different strengths, different people require different amounts of medicine, and we always try to use the lowest dose that we can and still have good control of the disease.
So what's maybe the most interesting thing that you've noticed in treating asthma patients? Has anything surprised you at all?
Well, as I already said, what I continually see with my asthmatics who've never had a good asthma doctor or been treated well is how much they put up with, because it comes on so gradually. So I've had patients who were wheezing and unable to do things they wanted to do almost every single day, and they were this way for months or years, and they just thought that's the way it was with asthma. They didn't realize there were alternatives out there that would relieve their symptoms, and they told me after the fact that they didn't even realize how severe their symptoms were until they felt better. So I'm surprised how many new asthmatics that I get that weren't being properly treated, didn't even really try that hard to seek care for their asthma, and how much better they feel once we get them on the right medicine.
So let's say I'm somebody watching at home, and I may be curious that I have asthma. I've not been diagnosed. I've not been to a doctor. Is there any sort of like self-test that I can do of like, I should get this checked out?
I mean, there's not really any testing that you can do, but you need to pay attention to what your symptoms are. You need to know when you're wheezing is limiting your physical activity, and we classify asthma based upon how often that occurs. So patients who are very poorly controlled will have symptoms every day or at least 3 days a week. They'll wake up in the middle of the night feeling short of breath, typically at least once a week. And when we have you on the medication, one of the ways we gauge control is when was the last time you had to use your inhaler, when was the last time you woke up at night and were short of breath or had to go take your inhaler. And so it really comes down to how often you're having symptoms of asthma. And when we do a good job and people are well controlled, I enjoy asking them the question, when's that last time you took your inhaler? And they have to think for a minute, and they really don't have a specific answer. And sometimes they say they forget their inhaler at home, which I don't encourage, but yeah. I'm glad that they're able to do that.
Do you think you kind of have a leg up when it comes to treating your patients who have asthma, since you have two folks who live with it in your home?
Yes. Any disease, if you live with it, you're going to have a deeper understanding of it. That's true of most things in life. So that's why I'm trying to get the knowledge out there, because I live both sides of it. I am a doctor who takes care of asthma patients, and I think I can make them feel a lot better. And I know the challenges of treating asthma and living with asthma, as well as some of the problems with cost of the medications. And so, yeah, it definitely gives me an advantage to see all sides of the problem.
Mm-hmm. Not mentioning brains or anything, but is it expensive to get treatment for this?
So the controller medications, which are inhalers that you take every single day, I have to talk to my patients frequently about the cost of those medicines. Most of the medicines are brand name. There's finally some generics in the last year or two. On my own insurance plan, which is pretty good insurance since I'm in healthcare, I pay $50 a month for each one of my household members. So I'm spending $100 a month on their controller medications just for 2 inhalers. And that's actually a pretty decent price. Without insurance coverage, it can be $300 or more a month. And so patients who have asthma and are uninsured, that is a great challenge. But there's also assistance programs from some of the companies, and we can talk to the patient and help them find a way to look into that, and they can still get treatment even with those financial barriers. It just takes a little more legwork.
Worst case scenario, if the asthma goes untreated, what happens?
Well, I mean, there are deaths from asthma, and usually it's some sort of an illness or some sort of a trigger, and they don't have proper medical attention fast enough, and there are people who die every year from asthma in the United States and all over the world, and that's tragic. Thankfully, that is very rare, and much more likely if they don't get to health care in time. If anyone has breathing problems, you want to call 911 immediately, and all the EMS services have the breathing medications in the ambulance and can give immediate treatment. And if that happens, then they usually do fine after a short hospital stay, but that's the worst thing that can happen. The other thing that I kind of mentioned is you lose lung function as you get older. Everyone knows that smokers end up on oxygen and have COPD and end up gasping for breath every day. Asthmatics also lose lung function. It's not nearly as fast as a smoker, but it's a lot faster than a non-asthmatic if they don't treat their disease. But as I said, these new medicines are so good that lung function is essentially normal in a treated asthmatic for their whole life, so it doesn't affect their lifespan. But if they don't see their doctor, their asthma is poorly controlled, they're going to lose lung capacity, and if they finally come later on, the loss of lung function that they suffered is permanent, so that we never get that back, but we can at least stop it from getting worse.
In our last minute here, is there anything else that you would like to add that might help somebody at home?
Just don't suffer through. Come and talk to your doctor if you have asthma. There's lots of good treatments now, and there are lots of new things on the horizon from the asthma specialist doctors. I can't do those myself at my office, but there are new treatments coming down the pipe and in clinical trials now that are going to be even better in the future.
Awesome. Well, thank you so much for coming on the show today. We appreciate it.
My pleasure.
And be sure to join us next time for our next episode of Being Well.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.